Hello and a very warm welcome. Thanks for tuning in to News 9 Live. Now we're going to be talking about India's new COVID challenge, and that's because the country has recorded a single-day rise of about 1,300 new COVID cases, which is the highest in about 140 odd days, while the active cases have risen to about 7,605. Now, the total COVID-19 caseload currently stands at 4.46 crore ever since the pandemic began, and the total death toll due to COVID-19 has inched a little bit towards 5.3 lakh, with 3 deaths each from Karnataka, Gujarat and Maharashtra being reported. The daily positivity rate is at 1.46%, while the weekly positivity rate is pegged at 1.08%. The number of recoveries has meanwhile surged to 4.41 crore, with the national recovery rate standing at 98.79%. But that's not all. Prime Minister Modi recently chaired a high-level meet to review India's preparedness to deal with the cases of influenza and COVID-19. He stressed on the need to follow COVID-appropriate behavior and maintain respiratory hygiene. Also, how crucial it's going to be to keep a track on the new variants. But how scary is the situation at the moment? Will it again lead to a pillar-to-post kind of a situation? Are we better prepared than the previous waves of the infection? A new viral spread of infection that is targeting the ear, nose and throat muscles and lending damage to those areas. And to answer the question of if and why you should be worried, joining me on the broadcast is, of course, Professor Dr. Sanjeev Bagai, Chairman of Nephron Clinic. A very warm welcome on the broadcast, Doctor. Always a pleasure to be speaking to you. Give us a sense of how you're looking at these new numbers. Even as influenza cases are spiking up, there is longer recovery. 1,300 cases, the highest uptake in about 140 days. Has that, sort of created ripples in the doctors' community?
Good afternoon. Thank you for having me. So Omicron is not over till it's over. We know that the surge, what we are seeing at the present moment is still in the early days as far as the Indian subcontinent is concerned. We've not tested enough in the last 6-8 months, so that would give a false negative as far as the true numbers are concerned. But this is not unexpected because globally the numbers have risen all over in almost all Western countries. For the last 2 years, if you see the total number of admissions which are there as far as the peak of Delta, in fact, the peak of Omicron in terms of hospitalizations globally is approximately the same. So Omicron, though it is termed as mild, it is not mild because it is, the word of mild is very relative. In normal healthy people, it will still remain mild and transient. But people with comorbidities and who are vulnerable, especially the aged and with comorbids, pre-existing medical conditions, it can still create havoc and indeed hospitalization. What we are seeing at the present moment in the last month or so was XBB 1.5. It's a sublineage of Omicron. Right. And I must add that Omicron has had more than 1,000 sublineages. It's the fastest mutating virus which is known in the RNA field. And now we are seeing in the last 2 or 3 weeks what we call as XBB 1.16. So XBB 1.5 and the offshoot of that is known as XBB 1.6. This is called as a third generation Omicron. So we need to be careful, but clearly no need to panic. India still is in a very good position because of an excellent strategy of the COVID vaccine campaign, which we've covered almost all the eligible adult population with 2 doses, although we need to still focus on the booster dose.
Absolutely. And that's the word coming from the doctor on the panel. There's no need to panic at the moment. Isn't that right, Dr. Bagai?
Absolutely. No panic, but be on guard.
Yeah, and the XBB, sublineage that you're talking about, I've had cases in my peers who are coming and telling me that, the recovery has been longer than usual. Not a lot of medicines were quite effective in the treatment. There are some of my colleagues who, there's a loss of hearing as well, and the targeting on the ENT area in particular. Could you throw some light on that as well?
Yeah, so we know that Omicron is mainly involving the upper respiratory tract. Although rarely it involves the lower respiratory tract. It involves the upper respiratory tract mainly because it doesn't use the normal ACE receptor binding protein as far as the entry point is concerned. It uses an alternate pathway through what we call as a TMP RSS receptor 2, which is that endosome. So it's not coming in through the door, but jumping in through the window. Rarely it tracks into the lower respiratory tract. So the upper respiratory tract is the throat, the pharynx, the ears, the nose, the back of the throat, So these are very typical symptoms, although there is not so much of loss of smell or taste in this new sublineage. The new sublineage of XBB 1.16 is peculiar because it has almost 70 shared mutations with XBB 1.5, but six of them are different as extra. And amongst these six, the two which are in the same platform of ORF, this is an alternative platform of the spike next to the spike protein known as ORF9b. These somehow or the other blunten the immune response of the host. It makes it more immune invasive, more vaccine escape mechanism, greater amount of breakthrough infections, and higher rate of reinfections. Each word is important: greater amount of breakthrough infections and greater amount of reinfections. So people who've not got the booster dose, it's of paramount importance that they get it done. Although it will not be as effective as if you had got it done earlier, but still it will give you almost a 50-60% efficacy to prevent infection and still a 90% plus percentage protection to prevent hospitalization and death.
And Doctor, can you help the viewers differentiate between the H1N1, the H3N2? These are also medical terminologies that are now being, sprung about with people having lesser, knowledge about what these actually are. Is it COVID-19? Is it separate from COVID-19? Shed some light on that as well.
Sure. So clinically, when a person comes in to the outpatient with a viral-like illness, the initial 3 or 4 days are almost exactly the same for any viral infection. So be it what we call as a common cold, which can be a non-influenza common cold, it can be an influenza-like virus, it can be indeed COVID-19. So what differentiates between them is between the flu, what we call as now the strain is H3N2, and COVID is having a larger incubation period. The influenza, a shorter incubation period, just 1.5 days. COVID lasts longer. Influenza is more self-limiting, and within 4 or 5 days, there's almost a 99% spontaneous and immediate recovery. COVID involves more number of organs, indeed giving even long COVID symptoms, whereas influenza again is more self-limiting. COVID generally has more of skin manifestations included and gastrointestinal manifestations, including loose motions, vomiting, abdominal pain, gripes, whereas influenza does not. But the first 3 or 4 days are exactly the same. The carry home points as far as the viewers are concerned is don't self-medicate, do not rush into any course of unnecessary antibiotics. Keep a simple regime of paracetamol for fever or headache or body ache. Inform your local doctor. Timing of your test is important. If you test yourself too early, it will come negative. If you delay testing, it will be bad. And isolate yourself in case you have upper respiratory symptoms or indeed fever. Wear a mask. Make sure that you don't carry this infection to others, inclusive of household contacts or indeed outside.
Right, and these are of course takeaway points, and thank you so much for eloquently putting those across. Give us a sense of what were some of the takeaway points that you took from the Prime Minister's recent meeting. There were, certain factors that the Prime Minister stressed on tracking new variants, influenza virus, and the preparedness of various states in tackling influenza as well. What are some of the key and salient highlights that you thought should be spoken about here?
I think the government of India has managed the entire COVID pandemic exceedingly well. And so have the scientists contributed and the entire medical fraternity. I must say that the entire Western bloc of countries who have almost 4 to 5 times higher infrastructure of healthcare, almost 1/6 of the population as compared to India, have had approximately 8 to 10 times higher mortality. Mortality is a given in a catastrophic, never seen before pandemic. But having said that, India has managed well. All these meetings are to be future ready, is to keep a step ahead of the curve, so that in case there is a surge which becomes more like a wave, we are more prepared. It's a question of making the vaccines available, getting the medical infrastructure rechecked that it's ready, making sure that the ICU admissions, the protocols, the hospital beds, the ambulances, the oxygen, in case it is required, it is ready. So I think we've learned a lot from the Delta wave. The entire world was caught napping, not only India, the entire world suffered in the Delta wave. to make sure that such a thing does not ever happen again.
And you did stress on those points, about masking up and essentially in bullet points for the viewers out there, Dr. Bagai, can you list out how, since the Omicron variant is attacking the upper tract of the respiratory system, how does one maintain respiratory hygiene in bullet points? Because these medical terminologies might not be, easily consumed by the layman out there.
Yeah, so I think to keep it extremely simple in layman language, in
Right.
case you have any upper respiratory symptoms or a sore throat or a cough or a fever or any combination of these symptoms, the first thing which an individual should do is don't go to work, don't send your child to school or college. Make sure that you stay at home and isolate yourself. You can walk around home once you're well, but wear a mask. The period of infectivity for the influenza-like disease is about 4 to 5 days. The infectivity period for COVID, which is SARS-CoV-2, indeed Omicron, what we are seeing at the present moment, is approximately 7 to 8 days. Test yourself on medical advice. Don't take self-medication at home. I have seen a host of patients who have taken medicines for fever and pain beyond paracetamol. That is not safe. Drugs like aspirin, nemosilide, or any combinations including ibuprofen are harmful not only to the intestines and the stomach, but they are harmful for destroying the platelets and the blood counts. Do not rush into antibiotics. Antibiotics misuse is a huge curse, in fact, on our society. A lot of people store antibiotics for prophylactic use. That's not useful. Don't rush into any medication which is not required. Test yourself as recommended by the doctors. Don't take any home remedies. We have also seen cases who've taken a lot of home remedies and then suffered. Just keep the principles simple. Most of the time, large majority of the time, even COVID as Omicron is self-limiting. Please do not panic, but make sure once you recover, you're in regular touch with the medical fraternity so that they can monitor you.
And doctor, at the same time, what does the data suggest? And again, as a disclaimer, not to politicize this particular question, there seems to be a lack of consumption of the booster dose. Is that being reflected across the data? And why do you think it is so? Why do you think lesser and lesser people are wanting to, get the booster jab?
I think it's more a question of a societal fatigue. It's a mental fatigue. It's a kind of a feeling of now it's well gone. COVID is gone, but I want to tell everyone, please get your booster. It's extremely important. The statistics worldwide have shown very, very clearly that your third booster dose will, in fact, really enhance your protection, not only to prevent infection, but indeed hospitalizations and death. My suggestion and advice to the government of India, the health ministry, is please make the booster dose, the third dose, readily available not only in government centers but all private hospitals, clinics, and medical establishments, and push the intranasal vaccine. That's extremely useful. The one which Bharat Biotech has already launched. It gives you a very, very good protection at the site of entry of the virus, which is your nasal canal, and it precipitates what we call as your memory resident T cells. This is something which gives you a long-term protection to prevent lung pathology in case you get infected.
Right, and communication and channels of communication and the health system have come really close. Take a look at how India tackled, polio. Take a look at how the messaging, the public messaging was sent across when we began our battle with COVID-19. But still, at this point in time, there seems to be a huge gap. How do you think this gap can be bridged in terms of awareness out there for people to consume?
Yeah, so again, the message can come from the medical community. The message can come from the government or indeed the media. And I think full marks to each and every media platform, be it the print, the electronic, or the social media, for the last 3 years having, sacrificed all other news and just focusing on this. During the lockdown and during the restricted periods, when no one knew in the world what was going to happen, the only mode of reaching out to millions and millions of people in a flash was actually electronic media. And I want to jog people's memory down. People were even scared to touch the newspapers at that time. Right. So the only mode of communication and to reach out to public at large was the electronic media, which is television and the social media. So I think we need to relook at a strategy. We need more regular public messaging from platforms like yours and other media houses. We need more regular shows. We need doctors to communicate much more. We need to keep telling them that the fight is still not over. We need to re-emphasize the importance of vaccines. Very quickly to mention three vaccines versus partially or unvaccinated, the difference of protection towards infection, disease, and death is 17 to 21 times. It's a huge number. That means you're almost 100% better protected by getting three vaccines. To re-emphasize the simple protocols and also to give a public messaging that
Right.
H3N is around. We can have mixed infections. The infections look almost the same. What are the do's and don'ts? What are the differentiation factors? So I think we need to relook at our messaging and public reach out strategy.
Right, and it has been a riveting conversation, Dr. Bagai. Just the last couple of questions. What do you think now, looking ahead, is one of the biggest challenges for a country like India? Also, I mean, feel free to touch upon some of the biggest COVID challenges in the days to come for the entire globe as well. And if we could ask this particular question out there, because you just mentioned that the fight is still not over. So is it safe to say that COVID hasn't really won, but neither has humanity at this point in time?
Yeah, I think largely India is in a much better place. But like I've said, the Omicron is so fast and rapidly evolving that we just can't afford to keep our eyes off the pedal. But having said that, I think we need a re-emphasis on having the newer vaccines. I've already mentioned very briefly on the intranasal vaccine, but I think we need a relook as to having our own indigenous bivalent vaccine. US, Canada, UK are using the bivalent vaccine for better part of last 5 or 6 months. We also need to have a re-strategized approach to having a pan-COVID vaccine, a pan-coronavirus vaccine. And I would very strongly request the Indian government to rationalize the cost of the influenza vaccine. It's still very expensive. It comes through 2 or 3 major multinational companies. It's out of reach for most people. But if we have an Indian brand which is cost effective and economical, it can actually help and save thousands of lives. And to emphasize the importance of masking. I think everyone has stopped wearing a mask. They stopped carrying a
Right.
mask. And this is not correct. Mask will prevent almost 90 to 95% of transmission and will prevent you nearing 100% of getting infected if your mask is well fitting and a high quality, high specification N95 mask. It's extremely effective, it's cost effective, it's very easy to carry, it's something which can be a difference between life and death.
All right. Well, that's the word from Dr. Sanjeev Bagai. Many thanks for joining us and helping us out with your insightful inputs. Needless to say, there's no need to panic at this point in time, but do pull your socks up, and whilst you're at it, do pull your mask up as well. We're going to slip into a quick break here. Content continues on the other side. Don't go anywhere.